Edutainment Studios welcomes you to Multiple Myeloma Treatment Guide. This module is part 4 of a 4-part series on multiple myeloma. Multiple myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Plasma cells help you fight infections by making antibodies that recognize and attack germs. Multiple myeloma causes cancer cells to accumulate in the bone marrow, where they crowd out healthy blood cells. Rather than produce helpful antibodies, the cancer cells produce abnormal proteins that can cause kidney problems. Treatment for multiple myeloma is not always necessary. If you are not experiencing any signs or symptoms, you may not require treatment. If signs and symptoms develop, there are a number of treatments that can help. In this course, the objective is to help you know how you can cope with having multiple myeloma. There are some simple self-care steps that can help ease your side effects. If you have nausea or are vomiting, you should eat a light meal or snack before your chemo or radiation treatment. Eat smaller meals. Have 6 small meals a day instead of 3 larger ones. Eat bland foods like chicken broth and crackers. Ask your doctor if anti-nausea medication might help. If you are constipated, you should drink plenty of fluids throughout the day. Try eating a high-fiber diet. Get some exercise and ask your doctor if it is safe to take a stool softener or laxative. If you have diarrhea, make sure to drink plenty of fluids so you do not get dehydrated. Eat bland foods. Ask your doctor if it is safe to take over-the-counter medicine. Call your doctor immediately if you do not feel better after a couple of days, notice blood in your stool, develop a fever, or lose weight rapidly. If your stool turns black or tarry, go to the emergency room. For fatigue, plan to rest by taking short naps a few times a day. Talk to your doctor if you have trouble sleeping at night. Stay active. Walking can help, as well as letting others help you do chores or run errands so you can save energy for things that only you can do. Keep a pain diary. Make note of when you have pain and what makes it better or worse. The doctor can prescribe medication, but it needs to be taken on schedule or as soon as you notice the pain. Do not wait until your pain is really bad to take your medicine. When you are diagnosed, it is normal to experience a mix of feelings that can include fear, anxiety, anger, and sadness, among others. It is also normal for you to need help coping with the feelings and changes in your life that melanoma can bring. To help you cope, you need to decide what and how much you want to know. Some want to know every detail, while others prefer not to know anything at all. Either way, communicate with your doctor your preferences. Sharing your feelings honestly with your loved ones will help give you strength and lessen anxiety. Asking your doctor what changes to expect will help you prepare for things like surgery scars, hair loss, and other side effects. Many cancer patients suffer from depression, so talking to your doctor about how you are feeling emotionally can be very beneficial. Talk to your doctor about starting an exercise program. Studies show that being active can help you cope with cancer. Putting a plan in place can ease your stress if you'll need to stay in the hospital, take time off work, or need caring for yourself. Allowing friends and family to run errands and do chores or take you to appointments can benefit your mood and energy levels in the long run. It's okay to continue with daily life as usual and perform activities you enjoy as long as you feel up to it. Eating a variety of nutritious foods and getting enough rest can help you better handle the stress of having myeloma. Seeing a counselor or joining a support group or online community can help to handle the challenges involved in living with cancer. The doctor can recommend a support group. If you have just been diagnosed, palliative care could be part of your treatment plan. The goal of this kind of treatment is not to cure the cancer, but to treat the symptoms and side effects of your cancer and treatment. This can include mental, social, and spiritual help. Like hospice, palliative care focuses on patient comfort and support. The difference being that palliative care is given much earlier in your diagnosis and is given alongside cancer-fighting treatment. Hospice care happens towards the end of life when cancer treatments are no longer controlling the disease. Palliative care is a broad treatment that addresses physical symptoms like pain, fatigue, and nausea. emotional symptoms like depression, anxiety, and fear, practical concerns like insurance questions, employment issues, and financial worries, spiritual concerns like questioning your faith, trying to understand why this is happening to you, exploring religion, and trying to find a sense of peace or acceptance. You can receive palliative care at different places like a hospital, cancer center, your home, or a specialized facility. You will often be treated by a team of specialists. Talk to your doctor about including palliative care as part of your cancer treatment. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 4 of this 4-part series on multiple myeloma.